Mackenzie and I'm going to be showing you how to do a wet to dry dressing change today. So first what you're going to want to do is go into the patient's room, introduce yourself, and do identification with the patient. Next, you're going to want to tell them what you're going to be doing today and explain to them the procedure. Alright, so let's get started. First what I'm going to do is I'm going to wash my hands. Then I'm going to apply clean gloves. Alright, now I'm going to pull the dressing off the wound. You want to be sure to start from the top and work your way in so as you do not pull anything off the wound that does not need to be. When you get that off, place it in your hand and you're going to now unpack the wound. After the wound is unpacked, you want to assess it. You look for the type of wound it is, the amount of drainage, and the odor. Now I'm going to discard the dressing inside my gloves and put it into a biohazard bag. And then I'm going to wash my hands again. Now I'm going to assemble my sterile field. When assembling your sterile field, you want to be sure to open the container away from you. Now I'm going to pick up my sterile dressing and lay it out, only being sure to touch the outside. You can touch the 1-inch borders because they are considered contaminated. And you don't ever want to reach across your sterile field, so walk around it to straighten it out. Now I'm going to dump the contents of my sterile field supplies into my sterile field, dropping them in about 6 inches above. And you can discard this. Now I'm going to prepare my basins that I'm going to use to clean the wound and to repack it. Again, pulling the lid away from you. Now I'm going to pour saline water or saline solution into the dressing basins. Now I'm going to, again, wash my hands and apply another pair of clean gloves. Actually, I forgot something. You also, if you have other supplies, you want to drop them into your sterile field before you clean your dressing, or before you clean your wound. Okay, now I'm going to apply my clean gloves. Okay, so to clean your wound, you're just going to grab some gauze and wring out the extra saline. And when you clean a wound, you're going to want to clean from the inside out. And collect the used gauze in your hand so you can dispose of it in a biohazard bag when you're done. And you can just throw these in the trash can. Next, I'm going to wash my hands and apply my sterile gloves. When you open the package, you want to dump the gloves onto the table, being sure that you don't touch the actual gloves inside. You can only touch the outside portion that they are wrapped in. You're going to apply the sterile gloves on your dominant hand first, using your non-dominant hand to pinch the inner portion of the glove and slip your dominant hand into it. Next, you're going to hold a hitch thigh or thumb and slip your 4 fingers under the lip of the glove. And now you're going to slip your non-dominant hand into this glove. And once you have your sterile gloves on, if the cuffs are messed up, now you can fix them by sliding your thumb under it where it's still sterile. You just start over the package by picking up where it's still sterile on the inside. Now I can reach into my sterile field. I'm going to use this applicator to help me pack the wound. You pick up gauze, squeeze out the extra saline, and you're going to want to put it into the wound, and you can use your Q-tip to help pack the tunneling parts of the wound. You do not want to overpack your wound though. And once your wound is packed, you can set this aside and you can throw it away when you're done in a biohazard bag. Now I am going to redress the wound. Again, going into my sterile field, grabbing the tape and a bandage. Lay the dressing on top of the wound, and now I'm going to tape the bandage down in a window pane fashion. And be sure to press firmly on the tape to make sure that it is actually intact with the skin. Since this wound is on the buttock, I'm going to maximize comfort for the patient by tearing a small sliver into the tape. That way it goes in between the buttock. And now all you need to do is document what you've done, and thank you for watching.